to another live edition with us here at the Plastic Surgery Group. I'm Terry.
I'm Joyce.
And we are joined today with Dr. Williams and his
one of our patients.
Yes, who's very kind and gracious to join us today so we can all educate you on facelifts.
This is something I can't even tell you how excited I am. As I've mentioned before, I've been doing this for a long time, been with the group for 13 years. Absolutely love Dr. Williams. I've actually had work with Dr. Williams myself. I think he's an incredible physician, as are all the doctors here. But one of the things I'm so excited to share with you all is the techniques that we do for facial rejuvenation. So many of us are interested in just getting a younger, a little fresher look and just looking more awake. You know, it's one of those things as you age, you start to notice little things and they mount up, and then all of a sudden, you know it's time to get a wake up, a little bit fresher look. So the thing that I'm so proud of here is I feel like our doctors are not just surgeons, they're artists, and you'll see when Dr. Williams explains how he examines a patient, what he sees in a patient's anatomy and personality and everything else. It all goes into the equation. So we're really happy that Kay's allowed us to have her share her story, and of course Dr. Williams is going to tell you what he sees. So I'm going to let you take it away. Dr. Williams,
well,
it's all yours.
First of all, Kay, thanks for allowing us to educate people. I think that today in the electronic media, as well as other sources of information that people access, facelifts can be somewhat confusing because you might see reference to many facelifts or the lift that can be performed and have patients back to a very functional level within 2 or 3 days. There is a fair amount of questions that people ask us when they come in, and I'm often surprised about how much information is not quite accurate, as opposed to some patients who will come in for body procedure consultation. Okay, they seem to have a lot of accurate information, and so what we try to do is educate our patients. But part of educating the patient is just listening to them and trying to find out exactly what parts of the facial rejuvenation might serve them best. What I mean by that is I usually try to get patients to talk, and I try to have them look into a mirror, and I try to have them prioritize, if you would, what their greatest needs are. So when you and I had that consultation, you were very specific about some things, and would you like to tell us a little bit about what you concentrated on?
I think the number one thing I pointed out on the mirror was my jaw and my chin.
Okay.
That was the number one.
And so we talked a lot about that, and I said there are various techniques that might be used to improve the jawline, but particularly we talked a little bit about creating more angulation to the face. And if you look at anyone, not just Kay, but if you look at anyone, you might say that their face as they age tends to look more square or boxy, with a little lack of jaw or a lack of jawline definition, as well as the lack of a neck. And so in restoring that for her, I tried to emphasize a couple of things. And you might see here, there's some drawings here, and I have I like to draw a lot, and I
For
like
the artist comes
and I think that it's important to help patients understand what I'm trying to accomplish at the time of surgery. I don't think that imaging tells the full story, although we do have imaging in our practice. So I think it's more comforting to the patient for them to know what we're going to try and accomplish and what we're going to do in the operation. So you can see I've really kind of outlined here what we're going to try to improve in terms of the neck, and how we're going to improve the jawline, as well as what we're going to do beneath the skin that structurally changes things, so that when we perform the facelift, the inset of the skin can be natural, so that there are no telltale signs in terms of step-offs of the hairline. Everybody has a natural sideburn, and so you want to leave somebody with a natural sideburn. You have a natural hairline in the back of your neck, and so you want to have a natural hairline without a scar there. You have the aesthetic features of the earlobe should remain the same. They shouldn't change a lot. And at the same time, you still want to achieve your goals in terms of improving that jawline as well as the neck. All right, so there are a number of procedures that we do, and I think we accomplished most of those goals for you. And then we also talked about the things that can enhance or complement a facelift, which is skin textural rejuvenation.
Right.
And the value of using our CO2 laser in the operating room and perhaps in the future as well, so that we continue to have your skin look more youthful and smooth and help you achieve those desired results of your skin as well. We talked about your eyes a little bit. So tell me a little bit about some of the things that you mentioned to me about your eyelids.
My eyelids were kind of droopy, I guess I would say, and I wanted to look more awake or not so tired. And I think I'm very happy with the results, I have to tell you.
So, you know,
Didn't you come down here from a little distance just to see? Yeah.
And I did drive from north of Dayton, as you know, because I don't mind. I've got to sing his praises along with Joyce. I love him. I wanted my number one goal was your skill. I have to tell you, okay. However, I have just been in awe of the whole office, of how personable and how you take an interest in the patient. So thank you for everything.
well, thank you.
Yeah,
Thank
we
you
appreciate
Thank
that.
you for sharing that with everybody. Let's talk about eyes for a little bit. They say the eyes are the window of the soul. So as we age, sometimes we don't show off those eyes, and particularly in women, there is a lot of value in where the brow is relative to the upper eyelid structure, how much extra eyelid skin is there that can be improved. And I believe that with upper eyelid surgery, I think less is more. We have learned that over the years ago when I was a resident of plastic surgery, I will be starting my 30th year in practice July 10th. So years ago.
Started when he was 8.
Years ago, the type of eyelid procedure that we were taught is greatly different than the eyelid procedures we perform now. We evaluate fat structure in the upper eyelids and in the lower eyelids as well, and we try to appreciate the value of fat in the upper eyelids. And so there is some art and judgment in performing the right procedure to the eyelids. I think for the most part, I think we could accomplish all those goals for people. I do believe that if there is one procedure that we probably don't perform enough of, is eyelid procedures. I think that most people, if they come in and they have a good consultation and they understand what we're trying to accomplish by affecting their brow position. Sometimes you can do that with Botox, you can do that with non-operative strategies. Other times, I think that the upper eyelid blepharoplasty is a procedure that can impart a great deal, it can enhance the appearance greatly without having a significant amount of downtime or time to convalesce. Convalescence is very important. And how we treat patients in our convalescence, everybody recovers along a different pathway and a different rate per se. And I think that, Kay, for the most part, you had pretty much uneventful recovery, had a little bit of a setback or two, but other than that, you were pretty much back to work and doing all the things you wanted to do very quickly, within a couple of weeks.
It was Kay, I have to tell you. I was really a little nervous because as a woman, you know, we've all gotten on the internet and watched a facelift.
Sure.
So I was a little nervous, and it was really much better than anything I anticipated.
Good.
I'm really not back to work because of my foot.
That's right.
Technicality.
I failed to
You
mention.
got to
Surgery.
combine the two.
Right.
So I'm like, I'm off for a very long time with my foot. Perfect timing.
There you go.
Yeah.
So nobody knows. When you go back, they'll just say, wow, you took a little sabbatical for your foot and...
Got some rest?
Yeah, got
I
a
have
little
to tell
rest.
you,
There you
I
go.
told most everybody.
Oh, all right.
Except
Good,
I
good.
didn't tell a group of friends, and I have to tell you, they're like, "Did you lose weight? You seem so awake. You really look good."
There you go.
I'm like,
Vacation.
"That's cool."
Fantastic.
What a
Right.
vacation will do
You're
for
And
you.
that's what I wanted. I didn't want somebody to come up and say, "Why did you have your face pulled back?"
And I think
You know,
that's one of the
completely.
things that women say to us on a regular basis,
Yes.
Lord knows I've heard this for years, is that you don't want to look done. You know, that's the biggest fear women have when you see something that was poorly done and the Hollywood kind of, you know, all the gossip magazines show you things where things were poorly done. If it's done well, you're going to look natural. You're
It's you,
just
but better.
a better
Yep.
version of yourself, a younger version of yourself.
Yep.
And that's what I think, like I said, I take a lot of pride in the fact that
I think there's a process that we help patients understand, that the process of facial rejuvenation is not necessarily a one-time endeavor. What we try to emphasize is some surgical rejuvenation, and there's a time in everyone's life when that surgical portion of facial rejuvenation may fit. There are other times in their life that may be non-operative strategies in terms of skin care, perhaps another laser resurfacing, Botox and injectables and fillers and things of that nature will be part of that facial rejuvenation, and then maybe other procedures in the future. Everybody ages differently. The bone structure does age, and I think it's important for people to know that when you begin this journey, and it is a journey, it may be over a 10, 15, 20-year period of time that you might be with a plastic surgeon in terms of facial rejuvenation. It probably, for me, is a part of my practice that I think has been so rewarding, because I get to see so many people during that period of their life. More so than more so than body rejuvenation that we do, or body contouring, but more so than breast augmentation. I think facial rejuvenation is something that I get to see people for a long period of their life, and that's kind of fun. You get to know people that way.
that's true. That's
Makes it
true.
more personal.
Yes.
I'll be coming here for life.
Also,
we like to hear that.
we love that.
That
We
makes
love that.
us
We
happy.
truly, I really appreciate the fact too that you said that you had a good relationship here. We really so appreciate our patients and value the friendships that we form. It is a bond, and because we do hope to see people coming back for whether it's skincare along the line or Botox or fillers while they're assessing, reassessing, and sometimes people start out with an upper eyelid, which, by the way, we have that remarkable in office.
Special.
If it's just your eyelids, $1,900 all inclusive here in the office,
Yep.
and it really is, back to work quickly.
Very quickly.
Very quick,
Yeah. So lots of minimally invasive things, and then if you're going for something surgical, I think you'd be pleasantly surprised
Yes.
by the recovery rate and how quickly you can get back into your normal everyday. So that said, we're going to end our.
We're going to end it, but
Thank
we're not going
you.
to completely
Thanks
end
for
it, because
everything.
again, we do appreciate every like and share that you all give us. We value all of our Facebook friends. We think you're fantastic, and we love how you give us feedback. So we really appreciate all of that. But we have another giveaway, which is very exciting. So you have until midnight this Sunday, June 3rd. Leave us a comment down below. Let us know what you're thinking. Ask us questions. We love to engage with our audience. We love to, bring you all into it and make it a little bit more personal for you all too. So leave us a comment, and you will be eligible to win a hydrofacial with us here at the Plastic Surgery Group.
And let us know what you want to see next,
Yes,
because
yes.
we are open to please you.
Any
make sure-
suggestions, any
Yes,
ideas?
we
Yes.
welcome it.
Yep.
Thank
completely.
you so much,
Yes.
everybody.
Thank you guys so much. Thank you, Kay, for
thank you,
joining
Kay.
us. We
Thank you.
appreciate it. Thank you, Dr. Williams.
All right, thank you.
So.